Hi, I'm Dr. Juliana DiGoisisa, and I'm an OBGYN at St. Alphonsus Regional Medical Center. I'm here to talk with you today about obesity and its effect on fertility as well as infertility. When you're carrying extra weight and you're pregnant, you're much more likely to have a miscarriage in the first trimester. You're more likely to get a condition called gestational diabetes, which makes your pregnancy a lot more complicated. And you're more likely to get problems within labor and delivery, such as having a C-section or having a shoulder dystocia. And shoulder dystocia is when the head delivers and then there's a lot of difficulty in delivering the rest of the baby, including the shoulders. And then if you do have a C-section, if you're obese, you're more likely to have problems with a wound infection or problems with anesthesia, getting the epidural placed correctly, or even problems with having general anesthesia. There's also a higher risk of stillbirth in the third trimester if you're carrying extra weight. So it really makes a pregnancy a lot more complex. A lot of the times when I have a patient come to my office and we talk about pre-pregnancy planning, if you can get into the ideal body weight range or even just above that slightly, it's going to increase your chances of getting pregnant, keeping the pregnancy, and having an uncomplicated pregnancy. If you're significantly obese and you're working on getting pregnant, you really do carry a lot more risk. So I encourage people to work with their doctor to, find a really healthy eating plan, try to get more exercise, and, really work on getting healthy before you get pregnant. Not to say that you can't get pregnant if you're carrying a few extra pounds, but it just really optimizes the pregnancy if you can try to get into a healthier body mass index range before you get pregnant. Obesity has effects on your gynecological health as well. And one of the most well-known facts is that if you are carrying excess weight, it does really increase your chance of getting cancer of the endometrium, or the lining of the uterus, which is the most common gynecological cancer. That tends to occur most often in menopause, and it happens most often in people that are carrying excess weight, especially if they have diabetes and hypertension. So reducing your weight can really affect your risk of getting endometrial cancer. The other cancer risk that is increased with carrying extra weight is breast cancer, and especially if someone starts gaining a lot of weight after the menopause, really increases your risk of getting breast cancer. So that's something a lot of people aren't really aware of, but it's a well-known fact.